Doctor, good morning.
Good morning to you.
Is there a relationship between malaria and sickle cell disease?
That's a good question. We have observed a lot of cases in sickle cell disease in our malaria endemic area in our western part of the country, especially Kisumu. Our body is always fighting whenever it's been attacked. And now when malaria cases are high, what happens is our body starts fighting against the malaria through a process known as mutation. And mutation simply means a change in our DNA. And that change in our DNA is designed to fight against the malaria, which we know as is sickle cell trait. That sickle cell trait is harmless and patients are asymptomatic. They don't have the signs and symptoms of sickle cell disease. But what happens is when two asymptomatic sickle cell trait, they don't know their status, when they marry one another, then there is a 25% chance of having an offspring or a child with a sickle cell disease. So that's why we need more awareness about who is having the trait and who is having the disease. Although it is a challenging, but we can try.
Okay, so that means that people from the lake region should not marry each other at all.
They should marry one another, but if they know they are carriers, then we need to do a genetic counseling before they marry one another. We need to tell them there is a chance, which is a 25% chance of having a child with a sickle cell disease.
Oh, it's sad. It means that sickle cell disease will never end in Kenya, right?
It's challenging, but if we try, if we maximize our screening, then we might minimize the cases we have sickle cell disease in the western part of the country.
Is it treatable, sickle cell disease?
Sickle cell disease does not, because it's a genetic disease. So the only curable, we can say, the only way we can treat is gene therapy. And then gene therapy is not yet out, but there are other medications that we can use to lower the manifestation of the diseases. The pain crisis, we can give the patient pain medication. And if there's an infection, then we can give antibiotics. And if there is a low HB or anemia, then we can give transfusions. But we cannot simply say we can cure sickle cell disease at this moment.
Thank you so much, Dr. Osman.
You're welcome.